The health department says it's worried about the increasing number of COVID-19 infections in the country. It says for the first time in a while, the infection rate has reached more than 2,000 in the past 24 hours. Now, let's talk about this. And we're joined via Zoom by Professor Mosa Moshabela, Acting Deputy Vice-Chancellor in Research and Innovation at the University of KwaZulu-Natal. Good afternoon to you and welcome. All right. Just this uptick in the number of infections, what do you make out of that?
If I may be so bold, I can say that we have now officially entered the third wave, and the same concerns we are seeing in Gauteng have also been expressed in the Free State, where their numbers have grown so much that they themselves have declared a third wave in the Free State. So I do think that it's something that we have to pay attention to and accept that this spike really it's concerning. It has triggered the third wave. We've been expecting it to happen. It gave us a space to breathe for a while, but now it's here and we have to confront it.
Yeah, Professor Moshabela, I know I have to put you on the spot here. Remember our last conversation, we said we shouldn't worry about the third wave then. And one would understand that during the time of optimism, when the vaccine rollout was underway and one was looking forward to a high recovery rate and low infection rate, and today, what we were not worried about then is happening now. Well, what do you make out of the push and pull in terms of predicting the play out of the infection rate in the country? Because if you look at the situation now, people were actually complying, washing their hands, sanitizing and putting on face masks, and now there's a spike.
Yeah, no, it's a very good point. It's in a way you can see it as push and pull, but it's also a balancing act. When we are in this sort of peaks and in resurgence, there's a lot of anxiety in society and we start to see calls for restrictions. And when we implement restrictions, then, they affect people's jobs, income, economy. So we kind of have to allow for those breaks that we have had, like we have had for the past 3 months. It's been a much needed break for many people, I'm pretty sure. And unfortunately, our vaccination rollout did not kind of unfold as rapidly as we had hoped, such that we could be in a better position at this point in terms of the number of people who might be susceptible to infections. Nevertheless, Colin, I think that we are here, and what we do need to do is to once again rely on South Africans to engage in kind of behaviors that will help disrupt infections. I know people are tired, people are fatigued, and yet, the virus is not tired, and it will continue to be transmitted, even for people who perhaps may choose not to wear masks, or they may choose to continue with engagements in social gatherings. They need to know that the risk has grown tremendously of acquiring infections, and we will appeal to them to make sure that they follow the prevention measures.
Okay, now let's delve deeper into this scenario. We've been having the infection rate going down, and we were standing at about 800 infection rate per day, and it went to 1,200 per day. So now that we have gone over 2,000 rand, this uptick, how do you define it as a third wave instead of just an increase in the second wave?
Yeah, no, it's true. The separation from the second wave and the third wave depends on the extent to which you decrease from the one wave. So from the first wave, we decreased to levels that were lower than 15%, 20% of the infections at the peak. So then when we entered the second wave, when the increases start to go beyond that original percentage that we had gone below, then we declared the second wave. Now, even now, when we are looking at the second wave, we came out of it and we declared that the second wave has ended because the number of infection had gone below that same proportion. Once you even hit below 10% of the original peak of infections, then you can see that you have controlled your infections to a level that you can cope with in the society. And we look at the positivity rate of less than 5%, which shows that the number amongst the people that you test, only fewer than 5% of the people are actually becoming positive. So in general, you're doing well. The moment you start to see an increase, the numbers going closer to 10% of the people that you test, then you are having a lot of people who are turning out to be positive amongst those you test. So these are the measures and indicators that we use to actually begin to see that the infection is going up, beside the one that we call a reproduction number that you may have heard of, which basically shows us the background transmission in the population. So all of these indicators are going up, and they are the ones that are telling us that we're entering the third wave.
So how different is this variant from the second wave? One understands that is the B1.617. So what is its severity in terms of its attack in the human immune system?
So, Colin, in South Africa at the moment, as far as we know, we are still dealing with the B1351 variant, or 501 YV2. We don't yet have any evidence to suggest that B1617 is circulating in the population. And we will depend, of course, on genomic surveillance to continue to do testing of people who are becoming positive to assess which variant is dominant amongst them. And as soon as we know if there are any new variants or changes in the variants that's dominating, then I'm sure we'll be made aware. At the moment, we can basically accept that the B1351 variant is the one that is still dominant. And also to remember that that variant is also still very highly transmissible. It doesn't necessarily mean that because it's been a variant that has been dominant here for a while, that its virulence, its transmissibility has reduced. It only can mean that perhaps people who have had an infection in the second wave may still have some sort of protection, but that protection also does not last more than 6 months. So I would say that, at this point, let's just assume that we are still dealing with B1351, which we know is dominant in South Africa.
Although one has to acknowledge that, the first wave and the second wave are dangerous, but then one can just hang in there and wish for the vaccine rollout program in the country to really reach everyone who is expecting it. But then the question would be, how dangerous is this imminent one?
Yeah, I think that we don't know for sure, Colin, but from the modeling that was done by the National Institute of Communicable Diseases, they are estimating that if all is equal, it should not be higher than the second wave in terms of the peak. But we don't know for sure. And in fact, they're actually hopeful that if we act early as South Africa in terms of people engaging in preventive behavior, as well as in terms of the government introducing some restrictions to prevent the spread of infection, then we may actually have an even lower peak of infections in the third wave. But especially because it has come a little later than we had expected. But I think that all of that depends on the balance of the actions that are taken and the behaviors that South Africans engage in. At the moment, we're not going to benefit from the vaccination itself. The percentage is still too low to actually give us benefit. In India, they had their severe infections with more than 10% of the population already vaccinated. So we are not even close to that. So I would then say that, we still depend a lot on a combination of preventative behaviors and restrictions.
We can certainly hope that we don't reach the level India has reached at the moment, but really we're going to have to leave it there. Thank you so much for keeping it so nice and simple. So today I actually don't have a reason why I should call you the Professor of Semantics.
Thank you.
All right, thank you so much, Professor Mosa Moshabela, Acting Deputy Vice-Chancellor of Research and Innovation at the University of KwaZulu-Natal. Let's take a quick break.